Thank you very much, Darren, for organising everything, and for Kevin for inviting me over. Very much appreciate it. If you have any pressing questions, feel free to ask from the get-go, but I suppose we'll leave most of them to the end because I have quite a bit to get through. So I'm going to give you guys an overview of the origins of the Behavioural Insights team, and then I'm going to run through 4 different studies with impact that I think might be interesting to discuss, and then finally we'll have time for questions. So firstly, the concept of nudge, are you guys familiar with nudge, the book Nudge? Typically, yeah, okay, fantastic. So although it's a relatively new concept in kind of the common parlance, it's been around for quite a while, and this is just one example of it. So this is, I think it's Manley Corner. It's a little corner in, I think, somewhere in Britain, photo from the 1920s, and it was renowned for the amount of accidents that would happen on this bend in the road. So they said, we need to do something about this. What is it that we can do to make sure that drivers drive on one side of the road, not the other? So here is one of the first examples of where they put a white line in the middle of the road. Okay, so it's a very simple nudge to avoid collisions, let's just say. Then we moved on. We have chevrons. When there's a lot of different lanes, have chevrons to kind of focus on the correct lane, and motorways or dual carriageways. Then we got the kind of the rumble strips at the side to make sure if you're veering off, get you back on route. Now we get a bit more technical, so there's kind of flashing lights in certain areas, maybe around schools or where a lot of pedestrians might be. There's speed cameras that inform you, give you feedback on whether you're going too fast or not. And interestingly enough, I think in the Netherlands, they have a lottery in place. So if you are below the speed limit, you get entered into a lottery to win a cash prize, which is a decent incentive. So the Behavioural Insights team, we were set up in 2010 in the Cabinet Office in the UK with a mandate to apply behavioural insights to policy. So apply the academic research from social psychology, from behavioural economics to policy, to make policy more reflective of how humans actually behave. We had a mandate over, I think it was 2 years, where we had a target to save X millions of pounds, or else we were scrapped, essentially. Luckily enough, things went well, and we saved, I think it was tens of millions over the course of this period. And in 2014, we spun out of government. So this means that we're still partly owned by the Cabinet Office, so a third owned by the Cabinet Office, a third owned by the employees, and a third owned by Nesta, a social innovation company. So when we spun out, this was in early 2014, we had about 15 staff members, roughly. In later that year, when I joined in September, this doubled in size and rose to about 30 staff. Now, in late 2015, we have close to 70 staff in 3 different offices. Main office in London, one office relatively recently opened in New York, and one in Sydney in Australia. We work across a number of different countries as well, but that's where our main offices are. And in terms of the disciplines of the staff members, we have a mixture of psychologists, economists, engineers, civil servants, marketers, a broad mix. So in terms of the institutional origins, the way this came about was that there was buy-in from the top. So David Cameron, Prime Minister at the time, during the summer of his election at the time, he recommended all his ministers read Nudge. And that's where kind of it started to seep into everyday thinking. On top of that, we have Lord O'Donnell, who was the head of the civil service at the time. He is an academic, an economist, and he was bought into the idea of behavioural insights and pushing the policy agenda forward. Additionally, we now have Sir Jeremy Haywood, who's Cabinet Secretary and head of our steering board. So he has strong input on what it is that we work on a regular basis. So when we think about policy and behaviour and how they relate to each other, there's so many examples of it. So the first example I gave is recycling. So you need to make the decision, am I going to recycle or am I not? And if you make the decision, yes, I'm happy to recycle, then there's all those kind of thoughts and decisions that you need to make while either going to the bin, choosing the bin, deciding what days, or figuring out what days you have to put the bins out, for example. Another example is voting behaviour. So you have to make the decision who you're going to vote for, or whether you're going to vote or not. Obesity, this is a mixture of whether you eat healthily or not, and whether you decide to exercise or not. And then there's the crime, so this kind of is twofold. So one side of it is, do you want to secure your possessions, or can you secure your possessions in a certain way, and the other side of it is whether you're going to steal something or not, or be dishonest, or whatever it might be. And it's very common for policy to be made behind a desk. A lot of times when policy is being written, it's informed by academic research and by policies from other institutions, but it's typically written behind a desk. So what is it that behavioural insights adds to this? So firstly, there is the psychology element to it. Okay, so how it is that we understand human behaviour. Secondly is economics, so standard economic theory is incredibly important in this context. Thirdly, public policy. What is it? You have to take a pragmatic approach when you're concerned with policy. First of all, is it implementable? Is it feasible? And on top of that is what is on the agenda of the day for the government. Okay, so these all inform behavioural insights. And finally, it's to do with the methods that you use. So I mentioned previously the importance of desk research, and that's how typically policy is decided. But there's also a lot of value in incorporating field research into policy, and ethnographic research. So understanding the customer journey, speaking to the frontline staff, speaking to the people that are experiencing and going through the process of the policy. And additionally, we vehemently believe in evaluation. So when you think of behavioural science, science is there, or behavioural insights, and you think of behavioural science, science is a very important word there. So we believe in that randomised control trials are the gold standard in evaluation, and across all our projects, the vast majority of them use randomised control trial design. So this is human-centric services. We understand how people behave in practice so we can design better policies and services. So there's a number of different traditional policy levers, such as regulation, incentives, and information. So if we take one example, let's take pensions. So in terms of regulation, everyone needs to pay into PRSI so that they can get their state pension at the end of after they retire. In terms of incentives, there might be tax breaks for you to save for a pension. And then there's information. So there's all the information campaigns that go along with don't forget to save for your pension. And in no way does behavioural insights try and replace any of these. This is more about enhancing, so in no way is this replacing the very thought through and useful traditional policy levers, but this is about thinking about, okay, how can we enhance this and push this along forward. As I mentioned before, we have offices in New York and in Sydney. There's a number of different examples of behavioural insights units or nudge units around the world. We've worked with a number of these, such as in the World Bank, Mexico, Guatemala, Jamaica, and a lot of places in Europe as well. So moving on to some examples of studies with impact that we've worked on. So as I mentioned previously, we typically our evaluations are designed through randomised control trials. Just very brief overview. I'm sure a lot of you are familiar with this design. So essentially, we take a group of people. We randomly split them into groups, typically 2, for example. We check that they're balanced, make sure that they're similar kind of demographics across both groups. We give one group the business as usual, so the policy of the day, whatever is happening at the moment, and then we introduce the new policy to the other group. Then after a time, we look at the differences between the two groups. Okay. So first question that I'd like to speak to you about. So we were asked we were working with the Department of Health on an issue that was very kind of a concern of them. So how can you encourage people to turn up for their hospital appointments? So do not attend, DNAs is how they're referred to. In 2012, 2013, there was 5.5 million DNAs in hospitals. Okay, this is enormous. Pardon?
What's this in percentage?
So this is about 10%, 11%. And it's useful to kind of have them figures in mind because, yeah, definitely useful to know kind of overall percentages, but when you hear 5.5 million, and if you could change that, tweak that a little bit, think about the impact. Each DNA is estimated, it's quite difficult to estimate these costs, but it's roughly £160. Okay, and there's additional costs. It's not just the cost, the financial cost, but think about the worst case care for patients because they're after missing an appointment and they're not after getting the checkup that is required. Inefficient use of staff time, so they might be waiting around for a patient to come in. Increased waiting times as well. And one of the interesting things is that hospitals tend to overbook because of this, as a result of this, which just complicates things even further. So why do you guys, what's the initial thought that, why is it that people don't attend hospital appointments? Any thoughts? They forget. That's it. So the main reason is they forget. So how is it that we can remind them? Okay, so this is just an overview of it. So we worked in East London Trust, which comprises 3 hospitals. We worked across 5 different departments that are listed here. And SMS messages, reminders were already in use. So we wanted to use the infrastructure that was already in place. And this is in the Mater, this is in Beaumont, so this is infrastructure that's in place here too. And we only focused on adult patients. So we spent some time considering what are the kind of ways that we can entice people through text messages to attend their appointments and to remind them about it. So the first thing that came to mind is, okay, friction costs. Make things easy. You don't want to overcomplicate things. You want to make things as easy as possible for them either to turn up or to let you know that they can't make it. Secondly, social norms. Social norms has been shown to be very effective in a lot of different instances. We have a lot of examples in tax trials. So getting people to pay their tax on time. We're reminding them that 9 out of 10 people pay your tax on time. You should too. And finally, could we make the cost salient? Because £160 per missed appointment, that's quite a big deal, and I think that might reflect on people, or might stand out to people. So we tested a range of different text messages. So firstly, this was the original text message that was sent out to patients. So very brief, here's the appointment, to cancel or rearrange, call the number on your appointment letter. What is it that stands out in this this text message? How are you going to find your letter? Okay, so, right, easy thing. Let's include the number, so reduce friction costs. Secondly, as I mentioned before, introduce social norms. So we also tweaked the wording on this as well, made it a bit more kind of human rather than a robot sending you a text message. We're expecting you at this hospital at this time. Finally, instead of 9 out of 10 people attend, we said not attending costs NHS £160 approximately. Okay. So we looked at what this meant. So this was over a 2-3 month period, and in total there was 10,000 individuals texted in this time. So control, the usual reminder text, brought about 11.1% DNAs. This was reduced to 9.8% in when we included the number, 10% when we introduced social norms, and reduced to 8.5% in comparison to the control group, which is statistically significant. Okay. So we weren't satisfied with that. We were kind of thinking, is there a way we can push this further? And we also vehemently believe in replication. So if there's an opportunity to replicate a finding, we always take it. So we said, okay, let's run this again. Let's see if there's other levers that we could use to push this down further. So firstly, fairness, justice. Is there a way that we can emphasise the fairness of not attending your appointment and what that means for other people? Or could we also introduce it being like, we'll remember that you didn't come up last time, you didn't turn up last time, so that reminder. So we looked at this. So these are the interventions, or these are the different text messages. So this is the same one as the first. We brought the most successful one forward and you tested it again here. Second one, we were kind of curious about whether it was a specific figure or whether it was general costs. So in terms of the fairness, please be fair to others waiting, and in terms of recording, we said we will record as a missed appointment. Okay.
When is the reminder sent out?
I'm not sure. I think it's about a few days, maximum a week before.
Did you have played with that?
Definitely.
Or 5 days before?
Definitely. I'm sure that they looked into that, and I'll get back to you on that, Kevin. Good question. So the first example, this is the original control. Okay, so it was 11.1%. When we introduced the fairness one, reduced down to 10.6%. Recording, we were recording this as a missed appointment, reduced down to 9.6%. General cost, 9.8%. And then specific costs, again, it was the most effective. Okay, so this is, the stars are in comparison to the specific costs, okay, not to this control. So this is statistically significant from specific costs, and so is that. But the recording isn't statistically significant from specific costs, but I suppose the effect of it is stronger. Yeah, so, and again, that was another big kind of sample size, so nearly 10,000 people were involved in this. So if we were to roll this out in just these 3 hospitals for a year, this would lead to 40,000 fewer missed appointments and £6.4 million savings. So imagine what this would mean if you rolled it out across the whole country. And of course, like I mentioned before, we're very interested in replication and making sure that the intervention is still is effective. Okay. Second study that I'd like to talk to you about is how do we recruit teachers to rural areas. So it's quite different in terms of teaching context. I suppose in the UK it's very, very difficult to recruit teachers in general. There's a kind of dearth of students, or a dearth of people going into the teaching profession. And some research, and this is a while ago, but they found that the quality of graduates who enter the teaching profession has decreased, and this is specifically difficult to attract the top teachers into rural areas. Okay, and there's less feeder programs, one of which I mentioned is Teach First, and I'll discuss that shortly. And specifically in Somerset. So we were working with a network of schools, of secondary schools in Somerset, called the Somerset Challenge. The county itself is sparse. It's a beautiful, beautiful county, but very sparse. The outcomes of the students when it comes to GCSEs or A-levels, so Leaving Cert, Junior Cert, are typically very, very similar to the national average. But when it comes to them going on to university, there's a drop. There's a drop-off. It's one of the only 3 counties in the whole of the UK not to have a university in the county, which they see as an issue and one of the kind of specific points. And in terms, this is an interesting graph. So this is the distribution of age and gender, London versus Somerset. And you can just see, sorry, it's not very clear at all, but basically you see this gap. So the blue line is London, the orange line is Somerset. So between the ages of 20 and 40, there's just a gap of people living in Somerset, which is very interesting. So what we did was we did some field work in Somerset. We spoke to students, we spoke to teachers, we spoke to head teachers, principals. They mentioned that it was especially difficult to recruit STEM teachers, so science, technology, engineering and maths teachers, and language subjects. Same adverts were used for years. They never thought about, maybe we should have another look at it. And there was never time. There was a lot of pressure on these teachers to do their day job. And also they felt that there was a lack of awareness of the rural poverty issue. So when you think about poverty, you often think about cities and let's say, that kind of context. But it wasn't as clear, that there is also poverty in rural communities. So we thought about different interventions. So one thing that came to mind was this piece by Nava Ashraf, Harvard Business School academic professor, and Oriana Bandiera. So this is an intervention that they trialled in Zambia to encourage people to apply for work as a community mental health or a community health nurse. And they just varied. A lot of the content is essentially the same. Format is essentially the same. The main tweaks is the messaging around, do you want to serve your community or do you want to gain skills? Okay, so it's kind of the contrast between the pro-sociality versus the leadership and the professional development. Okay, so we said, okay, why don't we try something like this? So teachers typically, the way that it's advertised them, and when they initially think of a job advert, they'll think of, I want to make a difference in a child's life. But our hypothesis was that this is what they know, this is an automatic thing. So we wanted to see, so we used this as a control. So are you ready to make a difference? If you're the kind of person that is committed to improving the lives of children, you're just the person Somerset is looking for. Okay? But we also wanted to say, is there an additional thing that we could add to it that kind of represents the leadership or the professional development that could be come through from working as a teacher in Somerset? So this is why we introduced that. Are you up for the challenge? If you're the kind of person that has the skills and dedication to thrive in challenging environments, you're just the person Somerset is looking for. Okay. So I mentioned Teach First before. Teach First is a social enterprise and charity. It's basically a teacher training program, and it typically hires high performing graduates and puts them through their paces essentially during the summer. It's about a 6 to 8 week course during the summer months, and then they're placed in typically kind of deprived areas in schools, and basically they teach on their feet, they learn on their feet. It's it's very well respected, and it's one of the most, I think, the largest graduate recruitment companies in the UK. So we worked with these, and we worked with the University of Exeter. So this is also a teacher training program to send out these messages. Okay, so we use the Teach First Ambassador Network. So they get ambassadors, are those that have gone through the program already, and they receive a monthly newsletter. And we included these the two previous messages as part of the newsletter. And then in terms of the University of Exeter, we sent this out via their course coordinator, the various emails. Okay. So what we found here, so the baseline rates for click-through rates, so that's what we were measuring. We were measuring click-through rates to the website, the Somerset Challenge website. Typically it's like 1 to 3%, so it's low. And what we found with the pro-social arm, that it was the high end of the spectrum of the baseline. It was slightly higher, which was interesting in itself, but it didn't tell us a whole lot. And when we introduced the challenge arm, this increased to 6.2%, which was statistically significant. So that was an interesting finding. And when I talk about studies with impact, one of the fantastic things that came out of this is that Teach First decided to take this on board and said, okay, we're gonna change our marketing strategy and introduce this kind of challenge frame into our national marketing strategy. So next study that I'd like to move on to is increasing diversity of the police force. Typically, it's been found that if a police force represents the community in terms of demographics and characteristics, it's more cohesive. Again, we were working in Avon and Somerset, again, southwest, relatively rural area, and we found that the population of BME, which is black and minority ethnic communities, they were not fully represented by the police force. Typically, there is between 8 and 10% BME community in Avon and Somerset, yet the police force the representation in the police force was less than 4%. When we went in and kind of, we wanted to look at the application procedure and the recruitment procedure, and we saw that there was one specific area that there was a big drop off. Okay, so applicants typically kind of sent in their initial application form, and then there was a situational judgment test. So this kind of put them through their paces. I think they measured 4 different things to do with consumer or customer decision making. If someone comes to you, how do you respond? Things to do with compassion and empathy, that kind of thing.
They're flunked at that stage. It's not that they're dropping out, is it?
Yeah, they flunk, exactly. So they're not passing this test, exactly. So although 5% of total applicant pool is BME, this drops to 3% after the test. So what we were saying is there a way that we can improve this? Okay. So one thing that came to mind is stereotype threat. You might be familiar, might not. This is defined as a situational predicament in which people are or feel themselves to be at risk of confirming negative stereotypes about their social group. Quite wordy, but it basically means that if you see a picture of, for example, an Irish person, you might automatically think they must be a drinker or whatever that might be. Or another example is women or girls tend not to be great at maths. One example. And this is context dependent, so it's not that people are affected by this across all contexts. For example, you might be particularly impacted by this in exams or sport events or social situations. It varies from person to person. And one example of mitigating this threat is the anonymization of exam scripts. So you're not reminded, oh yeah, I'm a girl, before you sit an exam test. a maths exam, excuse me. So self-affirmations is another way of counteracting this. So this is the recognition and assertion of the existence and value of one's individual self. So this is the self-affirmation intervention and inducing kind of people into a happier state has been shown to be quite effective in terms of kind of increasing coping strategies or and performing better on tests or tasks. I suppose theoretically, self-affirmation allows an individual to distance themselves from the negative thoughts or threats and to buffer these by reflecting on what it is that's important to them. Okay. So there's a few examples of where they've trialed this. One such example is in educational setting, where they in a classroom they handed out kind of envelopes to the students, and on the worksheet they had a list of values. Just as examples, like as in relationships with family or with friends, something like maybe a musical talent that you value very much, and then they were asked to choose one of the values and just write a short paragraph about it. And what they found was that this had a big impact on their later performance. So they compared the outcomes, educational outcomes of the European American students versus the African American students. For those in the control group, the African American students performed worse than the European Americans, excuse me, and in the treatment group, the achievement gap was closed. Okay. So we were thinking about, can we use this in the police diversity setting, in the police recruitment setting? One of the things that's sent out is an email. To the applicants, and this is just a chunk from the email. It's a little bit longer, but essentially the message was, this has been sent to you on behalf of X. You have been invited to complete the following online assessment. Click here. Complete the assessment. Okay. So we thought we'd change this email a bit. So firstly, we made it a bit more welcoming. So congratulations, you've successfully completed the questionnaire, and now you've been selected to go on to this next test. And then at the end, before you start the test, I'd like you to take some time to think about why you want to be a police constable. For example, what is it about being a police constable that means the most to you and your community? Okay. So again, it's that self-affirmation. What is it that's important to you? What are the values that mean a lot to you? So what we found was in the control group, so these are non-BME applicants and these are the BME applicants. So there was a split. So this is the probability of passing the test. So those that are non-BME were the higher percentage of passing the test, probability of passing the test. And you can see it was lower in the BME applicants. When we introduced the treatment, this leveled it off. So this was I think when we ran through the analysis, I think we did it about 7 times just to make sure that we were getting it right. But this is what we found with this. Now this isn't there's other stages to this application process, and we're keen to look at whether there is other drop-offs along the way. For example, in the interview stage, unsure. But we were very pleased with this result. So the last example that I'd like to give you, and I'm aware that I might be short on time, I think we're okay, cool. So how can you help people to find employment? And I'm very sorry if you were at the talk yesterday, but hopefully the graphs will be a bit more illustrative. So unemployment has been the top of the policy agenda since at least 2008, well, 2010, let's just say, across a lot of different countries, specifically in the UK. This has been top of the agenda, and it's something that's quite difficult to move, which is understandable to a certain extent. This has affected young people to a large extent, and this is just one graph kind of illustrating the trends. In the UK, the way that you receive your unemployment benefits is you have to go into a job centre. A job centre plus, is JCP is what was referred to. You have to go in, you work with a job coach. When I say work, it varies. It might be just going in, kind of checking boxes, essentially, to say, yes, I've applied for jobs this week, or no, I haven't. And essentially, you have to apply for a minimum. I think the minimum is 3 jobs per week, so that you get your benefit. And searching for jobs, it requires a lot of effort. And we were kind of interested in how can job centres induce the job seekers to exert more effort to their job search. Okay. So one of the things that I mentioned earlier was our field research. So Alex and Rory, two of my colleagues, they spent 3 weeks working in JCPs, speaking to the job centre staff, the job coaches, speaking to the job seekers themselves, understanding the customer journey. And these are some of the things that came out of it, okay? So advisors focus on terms and conditions and minimum requirements. That's why I mentioned about the minimum of 3 job applications a week. There's duplication of efforts on 9 forms such a first meeting. Getting a job can seem very daunting. Job search log rarely filled in properly. Again, generally do the minimum, i.e. 3 job searches. Okay, so there's a few things that jumped out at us at this stage. So, firstly, it was around the complexity of it. Okay, so when you go in initially, you're shown 9 forms that you have to complete, okay? So 9 forms. It's the first thing they have to do. So there's no conversations, like sit down, complete them forms, and then kind of we'll proceed to the next stage. Second thing was these targets that were set. So you have to apply for 3 jobs a week. Grand. 3 jobs, fine, I'll do that. But is that going to get you a job? There's a question there. And finally, there's the question around, I'm trying to think, what was the last one? We'll go to the next bit. Okay, finally the last one was they're always focused on the previous week. So what is it that you did last week? So there's 3 things that jumped out of us. So when a decision is complex, we tend to give up or choose an option that is simple. So if there's 9 forms to fill out, like and you only have to need to do 3 job applications, I'm gonna go with that. I'm gonna make it as simple as I can for myself. We can be influenced by targets set by others, as I mentioned. If job coaches are focused on this minimum requirement, then why wouldn't you go with that? And then making a commitment about future behaviour is more effective than reflecting on the past. Okay, so we said these are 3 areas. It's not about changing a large part of the job centre, but there's some tweaks that I think we can make. So first of all, we refocused the process. We reduced the number of forms that they need to fill out from 9 to 3, which is 3 is still a number, but there was no duplication. It was simplified. So this meant that, first of all, there wasn't as many forms to fill out, which is great, but also it meant that there was a conversation from the get-go. So the job seekers went in and had a conversation with the job coaches on day 1. And in this conversation, they talked about, why don't you, they changed the target, rather than kind of talking about kind of the minimum requirements, they talked about, why don't you apply for 100 jobs next week? 100 jobs might sound completely infeasible, but you're going to apply for more than 3 next week, if you hear that number. Anchoring has been shown to be incredibly effective in a lot of different contexts. And then finally is the commitment. The commitment, what is it that I'm going to do next week? And when am I going to do it? So the implementation intentions around it. So, okay, I'm going to get up on Tuesday morning and I'm going to have breakfast, and then subsequently I'm going to go to the library and apply for these 100 jobs, right? And this was co-designed with the Job Centre staff, and we started off in Loughton, Job Centre Plus in Loughton, so in the southeast of England. And again, we reduced the number of forms, and we introduced the commitment devices and the future planning. So what we did in Loughton was there was 1 Job Centre Plus, okay, and if we did an alternate allocation design, so when you went in the front door, you were either told to continue on in there or to go upstairs. So it was basically just first in goes that way, second in goes upstairs, okay. If you went downstairs, you got the standard policy as usual, whatever service that was in place originally. And then if you went upstairs, you got this new design. So we worked in Loughton for a number of months and collected the data on this. The outcome of interest was whether people were off benefits at 13 weeks. Over this time, we collected data on over 2,300 people. And what we found was those in the treatment group were 5 percentage points more likely to be in a job after that. We initially got an estimate of 9%, but then found that there was actually imbalance in the benefit history of those that were downstairs and those that were upstairs. So there was a number of limitations with this study. So there was scarce data on this, where there was no kind of job seeker covariates, except that we found out that at the end about the point about the imbalance in the benefit history. Hawthorne effects. So Rory Gallagher, not the famous guitarist, but one of our staff members, he is very charming, and the staff were very keen they were very motivated and keen to perform well, you know what I mean, get good results. That was something that we were aware of. Spillover effects, randomization issue, this was in relation to the imbalance, and displacement effect. It could have been that those within the job centre and were in the local area were taking the jobs from those in the control group. So there was that concern as well. But we thought these promising initial findings, but we require more research. So what we did was rolled out trial 2. So this was a stepped wedge design. Sometimes in policy, when you're rolling out a policy, it might not be just kind of the blanket day 1 across the whole country. Sometimes it's rolled out. So what we did here was just randomise the order in which it was rolled out. Okay, and as each month went by, we introduced a new job centre to the intervention. In total, this was across 9 months. We had over 110,000 participants go through this intervention, involved in this intervention. And what we found was in the control group, there was, this was the flowing off of benefits after 13 weeks. 56.8% of people were off benefits. In the treatment group, this was 58.5%. 58.5%. So this is 1.7% percentage points difference. What this means in numbers, so when we're talking again about the numbers with the DNA attendance, so this means that there was nearly 2,000 extra people that are in employment because of these tweaks. Okay, and this didn't really involve much, if any, kind of cost in terms of infrastructure or infrastructural change. It's more about changing the conversation and changing the forms. So that's something that we developed a training model in the Northeast. So someone from BIT, Behavioural Insights team, kind of trained trainers, and then this was rolled out nationally. In addition, it's been found to replicate in Australia and in Singapore. And yeah, that's it. Hopefully that was useful for you guys.